I never thought I would tear up like this for this part. Why didn't I think it was cancer? That never came across my mind was cancer. I just thought it was just probably a menopause. I had a cycle for almost 2 years straight every day. I had to get the adult diapers, and then I started getting bloated, and I had a lower back pain. My lower back pain I thought was due to work because I stood all day long. I went to get my pap smear done, and it came back normal.
It took 1 year for Alicia to realize the red flags happening in her body. Unfortunately, doctors would tell her she had ovarian cancer, becoming one of about 21,000 women in the US dealing with the diagnosis that year. She thought it was all over when she finished chemotherapy.
I rang the bell.
But the good news didn't last long.
Almost 2 weeks later, cancer is back.
Alicia discovered something about her ovarian cancer that also impacts more than half of all patients.
Be as strong as you can. I was a hairstylist. I was really into my career. Really started having a really awesome clientele. And I was on the roller derby team, getting really active. I thought I was going through the change and being perimenopause, because I was going a year without a cycle, and then all of a sudden I had a cycle for almost 2 years straight every day. Probably one day, not even 24 hours of being free of it. I had to get the adult diapers plus the overnight pads to go above the padding. The clots were coming in handfuls, and that was what was concerning to me. And so I started having pain as well. The weird thing was I wasn't getting tired like, you thought I would be because of how much I was bleeding. But the clotting was what was causing me to worry, because I never had that problem. And I never put 2 and 2 together of the symptoms I was having to go with the bleeding. It still took me a year to find a specialist. I don't know why it took me so long. I think in my head that after that day, it was to see if it would go any longer, to really see how the rest of the week would go, and ended up seeing how the rest of the year would go, because I wanted to make sure I had something to tell the doctors. They thought I had endometriosis in the beginning. They did a pelvic exam and seen polyps in my uterus. They did a procedure to remove the polyps, and it was supposed to stop the bleeding. My results for the biopsy of the polyps came back precancerous. She looked at my scans and she said, "Yeah, you have cancer." And I was like, "What?" And she's like, "You have 2 cancers at that. Stage 3C ovarian cancer and stage 1 uterine cancer." And I was like, "Oh my gosh." I'm like, "Are you serious?" She said, "So I'm actually going to fit you into my schedule for tomorrow for emergency surgery because you need this out." And I didn't have time to process because everything went so fast. The surgery was for a total full hysterectomy. She was trying to do it laparoscopic, but she couldn't because my uterus was so enlarged and inflamed. She said I had a hot mess in there for her. So they had to make an old school incision, and then she had to scoop out as much cancer as she could. Treatment was going good, and everything was starting to shrink, and my numbers were going good. Everything was looking good. And then we got to the last treatment, and they're like, "Okay, you can ring the bell, and if you want to." I was down to normal numbers. Everything was looking good, and I rang the bell. That's when they found out I was platinum resistant.
Platinum resistance means the cancer grows back within 6 months of finishing treatment. Around half of women with ovarian cancer end up with platinum resistance.
Now, unfortunately, a number of our patients, and that still falls into the majority, will develop recurrent disease. And very broadly, that recurrence can be defined as platinum sensitive versus platinum resistant.
Dr. Ursula Matulonis leads the gynecologic oncology department at one of Boston's biggest cancer research and treatment hospitals, Dana-Farber Cancer Institute. She says there's hope for ovarian cancer patients. New research is creating more treatment options.
I think it's important to remember that we have really a multitude of different medications to choose from. And I think that choice of medications depends upon where the patient is in her treatment journey, how many prior lines she's had, what clinical trials she's potentially eligible for, what histology she has. My job is to come up with treatment plans so that we're touching upon all those things. And it's really exciting for me to see medications that we can use now is so much different than even 5 or 10 years ago, really expanding what we can offer to patients. And I think that's really, really important because I think general oncologists have a very, very hard time. They're taking care of many, many, many different types of cancers. And it's really, it's quite, challenging for them to understand all these different cancers, their biologies, the new therapies, et cetera. So I think working with a specialist is really important.
Alicia ended up finding a specialist, something she hopes is an option for more patients like her.
I found one of the best chemo centers or cancer centers here in Florida, Moffitt. When she went through my records, she explained again about the platinum resistant, and that's when she introduced a new chemo to me. I still had hope.
I think hope is always important. I can understand if someone's not feeling well, then it's hard to be hopeful. But I think doing some research, if somebody has the energy to do that, understanding their cancer, really having open conversations with their oncologist about new therapies.
And she listened to everything I was saying, but I put it in her hands because she's a doctor. She knows what she's doing. So what's the best thing that you can possibly do for me?
Alicia moved forward with a new chemotherapy drug, but it wasn't effective long term, and hope felt harder to feel.
I actually became platinum resistant to that as well. It was working, but then towards the end, it just was not showing improvement. She was like, at this point, all we can do is to keep your cancer stable because you already went through 2 types of chemo treatments. That is the strongest for ovarian cancer. So lately, I just found out that I have a metastatic mass that just appeared.
I do think we're making progress. There's still a lot of work to do. I think the science is hugely important. Clinical trials are hugely important. They're not for everybody, I understand, and I think that is absolutely, someone should never be arm twisted into doing anything. But I think all different options should be presented to somebody, and there are a lot of options. There really are right now. I think that we have a long way to go and a lot of work to do. And again, it's really about histology, identifying underlying genetic abnormalities that are Achilles' heel, and then also following the cancer over time.
It's tough because you feel that there's an end or starting to clear, and then something new pops up to be as strong as you can, even when you feel that you're not. Because this takes you to a whole nother mental level of if you have mental health issues or not. this will take you to a whole nother level. And just know that you can live a long life, but you just have to have the bright mind frame for it and want to live.
Through all of this, Alicia hopes her story inspires others dealing with any diagnosis to keep fighting.